Dr. Max Seiter here with Vail Valley Live for the Ask a Doc segment. I'm an orthopedic surgeon with Vail Summit Orthopedics and Neurosurgery. I'm fellowship trained in sports medicine and I specialize in comprehensive treatment of the hip, knee, and shoulder. Are there different types of injuries for skiers and snowboarders? Yes, obviously both can have the same types of injuries. Skiing is going to be a more predominantly lower extremity injury prone sport, while as snowboarding is more frequently going to involve the upper extremities when patients are bracing themselves, not yet patients, but skiers or snowboarders are bracing themselves for a fall. Wrist fractures are very common with snowboarding. Shoulder injuries very common with snowboarding, including AC separation, shoulder dislocations. We see a lot more ligamentous injuries about the knee with skiing. ACL being a very common one. One that we see that is non-operative is an MCL injury, which is always good news to give a patient because it's just a little downtime and then we expect a full return to prior level of function without needing surgery. Fractures, etc. of the lower knee joint called a tibial plateau fracture, very common in our skiing population and will fix a lot every winter. How long is it okay for my shoulder to hurt after falling off my snowboard? Pain that is persisting for several days after a big fall is probably something you should have evaluated. We are always ready to see patients on a same-day basis. Anything that it presents with extreme weakness, an obvious deformity, or other truly concerning symptoms, you should be seen immediately. Any tips for my first ski season after an ACL tear? So this is one of my areas of particular specialty is ACL reconstruction. It is going to take on average about a 9 months for a full return to sport. But we are actually assessing the patient with the assistance of our wonderful physical therapist here in the Valley with what's called a return to sports testing. That's the general progression of all return to sports, is starting a little slower and then building up higher, just like professional athletes do. Does a broken collarbone mean my ski season is over? Depending on the pattern of the fracture, may be treated surgically or non-operatively. A broken bone versus a fracture, we may offer surgery for that particular clavicle fracture. Normally a patient is going to be, in my practice, allowed immediate active and passive range of motion coming out of the sling as soon as they can tolerate. It takes about 6 weeks for the initial healing of that clavicle to occur. Depending on the fracture itself, I may clear somebody for some lower risk skiing after about the 6 to 8 week mark, or it may be the 3 month mark. Are there winter sports that you should not do with a labral tear? If we have progressed you through physical therapy and you're doing well with your labral tear, then the goal is to return you back to all sports, whether it is with or without surgery. And that's the goal of all of our non-operative treatment, is get you back to full level of function, pain-free, and doing well. Thank you so much again for watching the Ask a MD segment here with Vail Valley Live. I'm Dr. Max Seiter with Vail Summit Orthopedics and Neurosurgery. Stay safe out there. Number one piece of advice, wear a helmet.